Good morning, good afternoon, dear students. Today we are going to discuss regarding tablets, introduction of tablet, advantage of tablets, and disadvantage of tablets, and ideal characteristic of tablet, classification of tablet. Myself, Dr. Sachin Patil, Professor, Department of Pharmaceutics, KLE College of Pharmacy, Belgaum. So, these are the contents of today's my lecture: advantage, disadvantage, ideal characteristic of tablet, and classification of tablets. So we are going to see first what are the tablets first. As per the definition, so as per the definition according to IP or according to USB, so tablet is defined as compressed solid dosage form containing medicaments with or without excipients. So the tablet are nothing but the solid dosage form which contains medicaments. It may be one medicament or two medicaments with or without excipients, and it is compressed form. So the tablets are almost in the all medicaments. Generally all APIs are formulated in tablet form except where it is difficult to formulate, like the substance which are liquid in state. Drugs are in liquid state, we cannot formulate the tablet. And then next is it is one of the most popular form of dosage form, and covers almost 70 percent of total medicaments. So it is most popular, most convenient, and most patient compliant. So tablets are used by all around about 70% of the people around the world. Then next, uh, so they are in various size, shape, and differ generally in weight because of the as per the content of the dose. Suppose some are the potent drugs and some are the non-potent drugs. According to the dose of the drug, the tablet size, shape, and weight varies. So, for example, if you take the cetirizine, which is very potent and with low concentration, we are preparing a tablet. So less amount of medicament is required, less amount of different excipients are required. So naturally, the size of the tablet will be very small. So if you take the another example, the paracetamol, which has the 500 mg of drug or more than that, 650 mg of drug is required. So naturally, the excipients required will be more. Then size of the tablet will be larger in size as compared to cetirizine, and then the weight of the tablet of that paracetamol will also be more as compared to the potent drugs. So the different size, shape, and weight is varying accordingly as per the dose of required. So next, how the tablet so if you see the absorption of drug from the tablet, how it occurs. Tablet first, if you the patient has taken the tablet, it disintegrates into granules, and granules into fine particles, and the fine particles are into very fine particles. It get dissolved in the particular solvent or dissolution medium, and then absorption will take place, and then it is after absorption it is circulated throughout the body. So this is how the tablet is containing drug, and it is absorbed in the body. So next, what are the advantages of tablet? As per the patient point of view, it is easy to administration, means a patient can take the tablet on his own. That is the as per the dose or as per the requirement, the patient can take easily. It is easy to carry. A patient can carry 2 tablet, 3 tablet to wherever the dose, wherever whenever he required, then he can carry the 2 or 3 tablet of with him, and he can take the tablet. So in the tablets, the odor, bitter odor or bitter taste can be masked by coating techniques. Once the tablet is manufactured, or if the drug or excipients are of bitter in taste, it can be coated and we can mask the bitter taste and odor of the tablet. So some tablets we can also prepare as a sustained release product, means our drug can be released from the tablet as per the requirement with the help of different polymers, and we can coat the tablet as per the with the help of different polymers we can prepare sustained release or control release tablet can be prepared. Other advantage of tablet is tablets can be divided into halves or the quarters, which facilitate the administer to take administer a fraction dose, means half of the tablet or sometimes quarter part of the tablet is taken according to the dose. So, according to the manufacturing view, it can be produced in bulk. So, large quantities of tablet can be prepared and it can be uh, packed or it can be stored in the bulk, and hence it is a very cost effective. So, batch size of the tablet will be more we can manufacture. So provides best combined chemicals and physical or microbial stability. So we have a large amount of excipients, and we have the physical or the microbial stability of the tablet is more as compared to other dosage form. If you take capsules or any liquid dosage form or any different dosage form, tablet has more stability as compared to other dosage form. Easy to pack and ship, then suitable for modified release pattern of the drug, and product identification is very simple because of the color tablets or because of the size of the tablet, because of the uh, uh, any advantage of the tablet can be prepared. So there are some disadvantage of tablet. It is difficult for administration in case of children and unconscious patients, or you may consider infants also, where tablet is very much difficult to swallow in these cases. So next is encapsulation or coating is required for drugs having objectionable odor, bitter taste, or the drugs that are sensitive to oxygen. So one more process is required if the drug is in case of this category of odor or bitter taste of excipients also sometimes, and then drugs having sensitive to oxygen or degradation, we have to further process it for the encapsulation or coating. Then it gives another one step to prepare or to make it odorless or to mask the taste. Some drugs are resist the compression into a dense compacts, so owing to the amorphous in nature and low density characters. So depending upon the property of the powder, so some drugs or some excipients or the powders cannot be compressed because of these reasons. Then see, I told you already, amorphous or hygroscopic or low density drugs cannot are very difficult to compress. So unsuitable for drugs that are taste bitter, and poorly soluble drugs pose problem during the tabling. And last one is cannot be administered to the unconscious patients. So these are some advantages of the tablets. Next, ideal characteristics of tablet. Tablet should be free from defects like chipping, picking, cracking, and discoloration or any contamination. Patients compliance plays a major role in the tablet manufacturing. Hence, maintaining the proper ergonomic properties of tablet becomes necessary. Tablet should possess significant strength to withstand mechanical shock, and it gets while during packing or during transport or during shipping or dispense. So it should be having that strength. Then a tablet should be able to release the medicinal agents in a predictable and reproducible manner. It should have chemical stability, and then it should be chemically and physically stable to maintain the uh, its attribute in on time. So next part we'll discuss regarding the classification of tablets. So classification of tablets, we have divided the tablet into four different major categories. One is tablet administered orally, that is compressed tablets, multi-compressed tablets, entry-coated tablets, sugar-coated tablets, film-coated tablets, and chewable tablets. One by one, we will discuss the tablets manufacturing. Second is the tablet used in oral cavity, that is buccal tablets, sublingual tablets, lozenges, and dental cones. Third category is tablet administered by other route other than oral route, that is implantation tablet and vaginal tablets. Then tablet used to prepare solution, that is Epperson tablet, dispensing tablets, and hypodermic tablets and tablet triturates. So one by one we will see what are compressed tablets. These compressed tablets are made from the powder or crystalline nature of the drug or granules material along or in combination with certain excipients, formed by compression and contains no specific coating. So the drug and the excipients are mixed together, and this is with the help of the granulation techniques. The granules are prepared and it is taken for tablet compression. So this is a general tablet. These tablets contain water-soluble medications that dissolve into stomach or being swallowed along the drug contents, and it is absorbed and disseminated throughout the body. So normal tablets, if you see the conventional tablets, are all compressed tablets. These compressed tablets may contain one drug or multiple drugs. Understood. For example, you see paracetamol plain tablets, or you can take the example of cetirizine, which has 2 or 3 drugs, but they are mixed with with different excipients, and then granules are prepared, and then compression is done. So first category, first class, we have seen the tablet compression. Second is interesting, that is multi Second is multi-compressed tablets or layered tablets. These tablets are produced by more than one compression cycle. So additional tablet granules are compressed on the previously compressed granules. So additional means once the compression is done, the second time compression is done with the drug and the excipients. So 2-time compression is done, that is multi-compressed or layer tablets. They are used to produce multi-layer tablets of 2 or more or 3 layers. The ingredients of the formulation expect the incompatibility material are compressed into tablet, and then the incompatible substance along with the necessary excipients are compressed over the previously compressed tablets. So if there are 2 or more ingredients which are incompatible with each other, so the material which first is taken and compressed, and then the second material or the excipient or the drug is mixed with the excipient, and it is again compressed, previously compressed tablets. So we can we get 2 layers and or the multi-compressed tablets. So third one is sustained action tablets meant for release of drug at a desired time and prolonged effect of the medicaments. Actually, they help in maintaining the maximum effective concentration of drug in the body by releasing the medicament at a suitable in a suitable quantity as and when required. So example of this tablet is diclofenac SR tablet, sustained release tablet. So fourth one is enteric coated tablet. These are designed to bypass the stomach and get the disintegrate in the intestine only. So specifically, if you see the drugs which are more which are very much they degrade at the acidic pH. So to bypass the stomach, we coat with the polymers uh, which protect our drug from the acidic environment. So such tablets are coated with the materials resistant to acidic pH. Example is cellulose acetate patellate and the gastric fluid, but get disintegrated in the alkaline pH, and after disintegration, the drug is released and the dissolution and absorption takes place. Fifth is sugar coated tablets, a type of compressed tablets containing sugar coating. After compression, the further process is carried out for coating and used to increase the organoleptic properties and mask the bitter taste and unpleasant taste or odor of the medicament. It makes the tablet elegant as well as it safeguards the drug from the atmospheric effect. Means our drug is very prone to oxidation or moisture. So the coating will help or protect our drug environment. And then film coating tablets, they have a film coating of some polymers, film coating solution is prepared, and that film coating solution contains the polymer, solvent, colors, and plasticizers. The composition is sprayed on the tablet, and this generally film coating is helped to produce or manufacture the functional tablets such as sustained release uh, tablets. These tablets are generally are tasteless because of the coating and do not increase the weight of the tablet. Generally, only the layer of a thin layer of the polymer is coated on the tablet. Only 2 to 3% of the weight is gained in film coating, but as compared to sugar coating, 50 to 70% of the weight is increased. Bulkiness is increased in the tablet. The size of the tablet or the shape of the tablet in sugar coating will also change, but in case of the film coating, the size and shape of the tablet is retained. So these are less elegance as compared to sugar coating, because sugar coating are color tablet and very elegant, but in case of film coating they are not elegant and they remain the same shape and weight. So next is chewable tablets. These tablets are required to be broken and chewed in between the teeth before the ingestion. Given to children to facing difficulty in solving those or the person who has a difficulty in solving, they are chewed before the uh, solving. They should have very good organoleptic properties because of the taste or odor and because of the flavor. You have to mask and the tablet is prepared. Example is antacid tablets or vitamin C chewable tablets. Then next category is tablet used in oral cavity is buccal tablets. They are placed in a buccal pouch, that is side of the cheek, and here the tablet get dissolved or eroded very slowly. It get absorbed by the buccal cavity by without passing into alimentary canal. So directly it is the drug is dissolved and absorbed at the oral cavity. Then but they have certain amount of hardness and formulated and compressed with suitable pressure. Sublingual tablets. These tablets are placed under the tongue where they are absorbed quickly. They are get absorbed directly without passing through the GIT. Example: nitroglycerin tablets and lozenges designed for local effect in mouth or throat. These are used to treat the sore throat to control the coughing in common cold or the infection, local infection. They may be in the form of local anesthesia, antiseptic drugs, or antibacterial agents and astringents are formulated. These lozenges are formulated by compression at the high pressure by molding process, and they generally contain sweetening agent, flavoring agent, and substance that reduce the cooling effect. For example, Vicks and Strepsils. Then dental cones are meant for the placement in the empty sockets after the tooth extraction. Similarly, because of the tooth extraction, these type of tablets contain antibacterial compounds, because we have to because of the tooth extraction, there should not be growth of microorganisms. So these dental cones generally contains antibacterial agents. These tablets contain excipients such as lactose, sodium bicarbonate, and sodium chloride, and get generally dissolved in 20 to 40 minutes. The shape of this dental cone is usually the size and shape is generally after it has to be placed in the area where the tooth extraction is done. So normally the shape differs accordingly. So tablet administered by other implantation tablet. The implants are used for the administration of hormones such as testosterone or any contraceptive hormones. These tablets are placed under the skin or inserted subcutaneously by minor surgery and are absorbed very slowly. And the implant should be sterile. This is the important criteria for implantation tablet and should be placed individually in the sterile condition. So minor surgery is required to place the tablet. So they are usually broadly from birth control in human beings and change rate of release with the change in surface area. In the vaginal tablets, these are typically oval or pear-shaped tablets meant to dissolve slowly in the vaginal cavity, and they are used to release the steroids and antimicrobial agents. So these tablets are for local action. If you see, the implantation tablet is not only for local action. These tablets are for generally for slow absorption or slow absorption throughout long period of time, and this vaginal tablet is for the local effect. Generally, it is given. Then last category D is tablet used for preparation solution. Effervescent tablets. These tablets contain active medicaments along with the ingredients like sodium bicarbonate, citric acid, and tartaric acid. These tablets get reacted when they come in contact with the water and liberate carbon dioxide and produces effervescent, causing disintegration of tablet, and tablet goes into the solution state. Example, Histac, that is ranitidine, or you can take another example. There are a number of example tablet which used to prepare effervescence. Then dispensing tablet. These tablets contain convenient quantity of potent drugs which can be readily converted into powder and incorporated into liquid. This avoids the need to weigh the small quantities. These tablets provide convenience for the extemporaneous compounds and should never be dispensed as a large dosage forms. Then hypodermic tablets, they are soft, readily soluble tablets and originally used for preparation of solution to be injected. So generally these tablets are dissolved in sterile water or water for injection, and they are dissolved in the particular sterile water for injection, and then the injection is given to the patient. Currently these tablets are not being used, but sometimes sometimes we required when the drug is not generally stable in the vehicle or water or sterile water for injection. So generally these tablets are used to prepare the injectable. Fourth one is tablet triturates. Trituration is nothing but the dissolution with an inert substance. These are the powder molded into tablets, and they are flat, circular, discs in shape, and this contains potent substance mixed with the lactose, sucrose, dextrose, and other suitable diluents intended to disintegrate very quickly in contact with the moisture, and water insoluble adjuvants are avoided. Thank you.